Sash emergency vet Lisa Chimes has also volunteered to come on the trip. But the Brown boys are not sure how she'll cope.
Where does Lisa think she's going to Shangri-La Resort?
What are those?
These shorts?
You're not, is that for real?
What is it with the shorts?
You cannot wear those on the plane.
I'm not sure what's going to be bigger, the veterinary care package or Lisa's luggage.
The vet team have arrived at Nadi, Fiji's third largest population centre.
Couldn't help noticing your shorts.
Are you serious? Did you set this up?
I told you not to wear them.
A bit too flowery for Fiji, eh? But anyway, on this occasion, I'll let you.
Thank you.
Good luck.
What? Thank you.
Graeme has already seen the SPCA vet clinic in Nadi, which is run by 2 volunteer vet nurses. But for Chris and Lisa, the basic premises are a reality check.
Oh my God, I just can't believe the condition here. This is a vet hospital. They've got nothing.
We're heading out to a local village. We've been asked by the head man to come out and take a look at all their animals. We don't know what to expect, what we're going to have to treat, but we're going to do our best.
Never seen anything like it. We've got an outdoor vet clinic under a mango tree. So we'll see what we can do.
Most of the operations today will be desexing, but without anaesthetic machines, even this routine surgery can be risky.
We don't have any clippers here. Old school.
Blackie is Chris's first patient. She weighs just 7 kilograms.
The worry for me is, given the fact she is so skinny, it's very easy to overdose her, so we just have to be so careful with every drug we use.
The surgery can't start until Blackie is completely under.
No, she's feeling that. She's just moved her head. I don't want her to feel any pain. I don't want her to wake up in the middle of Chris doing this, so it does really get my heart rate up and make me very anxious.
On their first trip to Fiji as volunteers, Chris and Lisa are learning to deal with some tough realities, performing desexing operations in the most primitive conditions.
It also makes me realise how tough these people do it. I mean, this is making me panic. I just have to try and accept that I'm out of my comfort zone here.
Okay, little ones? You're happy to watch, but just stay away from the table because it needs to stay clean, okay?
Fiji's only resident vet, Deb Houghton, has arrived from the Suva office to help with the outdoor clinic. Often villagers have never seen a vet before.
A lot of the time people don't really know even what desexing is or neutering. They think it's going to decrease their ability to be guard dogs. Education is the key, and without that we're fighting a losing battle really.
Blackie's operation has gone smoothly and her grateful owners have witnessed the whole procedure.
Not used to having the owners watching my operate. No, I'm fine with it. I'm very happy with it. It's just different for me.
I'm happy she's getting this.
Hey Blackie, you're no designer dog, are you? But you're all right. Okay, you came through that well.
Uncontrolled breeding just isn't on, and in a place like the Fiji Islands where there are a lot of dogs, it's important to get that message across that dogs do need to be desexed.
All right, folks, welcome to Matangi.
Thank you, Nigel.
News of the vet team is spreading quickly. A call for help has come from the owners of a resort on Matangi Island, a 40-minute boat trip from Taveuni.
It's all right, this, isn't it? That's after the cyclone. Imagine before the cyclone, it was amazing.
As you know, there's 330 islands in Fiji, and there's usually just one vet in the country. So the chance of getting 3 is a miracle for us. We're really glad you guys are here. she somehow managed to do a somersault, believe it or not. She got up on her back legs in the corner and flipped over and landed on her back.
Lisa and Graeme are on their way to examine Nigel's badly injured Maltese Terrier, 8-year-old Etty.
Yesterday she got really, really bad. She could hardly walk. Her back legs were crossing and she was tipping over. And then I heard you guys were coming to town and it was like angels from heaven. Because she's been through a lot and she doesn't deserve to be in pain. That's the main thing. Hey, little darling.
Etty has other medical issues. She's blind and suffers from seizures.
I've got her. It's okay. I'm very worried if it is a case of a spinal problem and she needs surgery, and we're on this remote island here in Fiji. I don't think spinal surgery is even done in Fiji.
So how many years has she been circling now for?
2.5.
After falling on her back several days ago, 8-year-old Etty has been in severe pain and is finding it difficult to walk properly.
See, what we're trying to determine here, Nigel, is whether there are any problems associated with her spinal cord, to see whether the reflexes are getting through to her brain.
Yeah, so there.
Yeah. Just saw that. It's right lower down the lumbar spine.
If Etty does need an operation on her back, there are further complications. The local airline will not allow pets to travel on their planes.
If you have an emergency and your pet is in distress, what are you going to do? There's no flying doctor service like we have in remote areas of Australia. It would absolutely be terrifying.
She's precious. She needs care. And we're blessed. We are blessed to have her and able to give her a decent sort of home.
Now, I'll count if you like.
Okay.
And which way are you going?
I'm going to go this way first.
Okay.
Graeme is not convinced Etty's inability to walk is caused by a spinal injury.
Look at your eyes after this.
He's hoping this simple spin test may provide more clues.
She's got normal position on the stigmas. I'm going to say something that's going to be different to what you're expecting to hear in terms of what's wrong with her.
Sure.
Okay? So what we actually think is going on is that she's got a problem with her brain. It's like a meningitis. So it's called GME, and basically they get inflammation in their brain. GME can be life-threatening, so there are cases where we give them medication and they don't respond. Best case scenario is that we put Etty on cortisone and she responds. Hopefully she'll stop circling, she'll be able to walk normally, she won't fall over. She may never be a normal dog, but we want to get her to a point where she has a good quality of life. Thank you.
Thank you very much.
Thank you, Nigel.
Okay,
Yeah, thank you for coming.
thank you.
Okay, you respond to your medication now, and that's an order. Doctor's orders. Okay? Yes. She says yes.
Absolutely.
I've found this trip very confronting. Fiji's animals are in desperate need of help here, and the Fijians need to learn how to look after their animals. They need education and they need volunteers, vets from around the world to come and help them do that.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.